Welcome back, everyone. As part of our ongoing coverage of this crisis in our communities, we wanted to talk to Angelo Calbone. He's the president, CEO of Saratoga Hospital, and obviously a leader in the community and a major player in this crisis. He's joining us this morning. Good morning, Angelo. How are you?
Good morning.
Very
good.
Yeah, good. Thanks for taking the time. I hear you clearly, Angelo, about the risk in people postponing or not wanting to go to urgent care or to go to the emergency room. Mixed in with that is elective surgery. People are putting that off as well. What's your advice to people who are sitting there? They're scared. They're not exactly sure what they want to do. What's your advice there, not only in terms of going to the emergency room or emergent care, but for elective surgery as well?
Well, my first piece of advice is talk to your physician. Discuss what your issue is, what your needs are. Some cases that are truly elective and can be done anytime, the patient's more comfortable delaying that. That's okay. Our concern really is in the world of delaying cases that, while we may describe generally as being elective, shouldn't be delayed. People who are in pain, people who have conditions that may worsen. We know we've created a safe environment here. Patients are tested, surgical cases are tested, and we're doing a great job of bringing people through the organization, getting that work done. So if people are delaying work because they believe they will be, at some higher level of risk, again, we believe the risk to patients is probably greater delaying care, much greater delaying care than being exposed to coming into the institution. And we've seen that play out with how safe our staff has been and, other cases that have come through that we do not have any incidents of cross-contamination or hospital-acquired infections regarding COVID. So our advice is, talk to your physician about what your needs are and what your issues are. They're all very aware of what we're doing and how we prepared the building. It can offer some really good advice. But I strongly advise to not delay care simply because you're afraid to come into this environment to receive care.
Have you experienced any shortcomings in terms of PPE, the protection equipment for your staff, or any of the other things that people might be concerned about?
The answer to that's no. And the reason we've been able to say no to that is that early on, we adopted conservation methods with PPE. I managed it very well. Our purchasing folks were aggressive, is an understatement, in trying to source and create an inventory here. And we were moderately successful with that. That, along with our conservation methods, has gotten us through. So while the sky's not the limit, we're perfectly situated to do the work that's coming back to us right now.
One of the things that comes up a lot is testing. And you're kind of the epicenter for that kind of information, right? And do you find that you do have adequate testing supplies and that you will be able to? We're a community, obviously, that draws a lot of people from Connecticut, New Jersey, Pennsylvania, downstate. And even though, we got the news that the track may run without a live audience and SPAC had to cancel the jazz festival and whatever, people will want to get out. They're going to want to get out. Even people in our own community are going to want to get out and support our local economy, Ange. What about testing? Do you feel confident that you'll have enough?
I'm hopeful we'll have enough. I'm not all the way to confident yet. Testing capacity has been a struggle. We have adequate capacity for our patients, our surgical patients, and all of our internal needs. So we have been able to manage that well. But when you begin to envision stepping into community-wide or region-wide testing, more capacity needs to be brought online to do that well and to do it consistently. So while we've been able to test at the levels we need to test here to keep our organization safe and our patients safe, to do wholesale community-wide testing, there needs to be more capacity that gets ramped up.
Angelo, I've been talking to a lot of leaders in downtown, chamber, tourism, and whatnot. A lot of talk about reopening and how we're going to reopen, and that our situation upstate is very different than downstate. Obviously, central to the information and the decision making is input from the hospital. Do you find that you are able to work with the chamber and tourism and downtown retail to try to figure out what the best practices plan might look like?
Yes, we've had multiple conversations, some informal with local leadership about what's happened here and how what we've learned could be applicable to their world. We've also had formal interaction with the County Reopening Committee and even including NIRA to share some of our data, some of our trends, and really our experience. We've been at this now quite a long time, and we've developed protocol and patterns and approaches to how we take care of our patients, how we take care of our staff, how we protect the building. That really is very consistent with what local businesses are going to need to do. The formal side of this that we'd like to engage, you may or may not know, we have an occupational medicine program here headed up by Dr. Michael Holland. In normal times, that program helps with local businesses managing the healthcare needs of their staff. As an example, pre-employment physicals. Occupational medicine has been in the middle of our response here internally. So we're going to use that program to reach out to local businesses and try to offer support, guidance, and consultation on their reopening plans, how to manage their environment. Again, we've accumulated a lot of experience now. We think a good deal of that can translate into what other businesses should do and how they need to operate. And we want to make that available. We want to be as supportive as we can be to our local community so we can get businesses open, but importantly, open safely and protect the health and welfare of our community. So we look forward to being a part of that in any way that makes sense.
Oh, I've got it. Well said, Angelo. One last thing in closing. Judging from the color of your hair and mine, by the way, we never thought we'd ever see this. We've seen a lot of things. We've seen Man on the Moon, but we've never seen this. From your own personal perspective, you're a leader in the community. You run the hospital. Healthcare workers are giving new meaning to the term local heroes. Can you believe the dedication? Give me your own personal thoughts on this. What message would you like to send out?
I'm not sure I can really capture that in a couple little points. Thank you for noting the staff. I'm speaking for Saratoga Hospital, but I think this describes community hospitals and their staff, in general. I have been in absolute awe of our entire organization, no matter the position. Nurses are on the front line, they step right into it, and they're standing shoulder to shoulder, taking great care of these patients and all of our patients. Our physicians are here doing good work, our support staff are here. I have never in my career seen this kind of focus, commitment, and determination from a healthcare staff in my entire career. So I've been left in complete awe with that. And I hope the community sees it and feels it and has a level of confidence that I believe they need to have in their local providers. So that's probably my biggest personal takeaway. Again, I'm not going to say anything that's particularly unique. I mean, this is a scary disease. It's unpredictable how it affects people. Sometimes appears somewhat random. But our community had the opportunity, unfortunately, to see what was happening in New York City really before it took hold here. I think we have proven to ourselves by taking appropriate steps, masking, social distancing, you can still move about and keep yourself relatively safe. You have to follow those protocol and practices. I think I believe if we let our guard down and give up on distancing, masking, hand washing, and taking this seriously, it would likely rebound on us. But I think we could go pretty far down the road of kind of reemerging if we stay very true and committed to those kind of protocols.
Boy, well said. I couldn't agree with you more. The tendency is to, to say, okay, we're better. We can go out. We don't have to worry about social distancing and, listen to science, right? That's what it comes down to. And just do your best as human beings. Angelo, hats off to you and everybody at Saratoga Hospital. You're the epicenter of something that we never saw coming, and obviously doing a fabulous job. So best to you, Kate. Stay safe, okay? And we'll check in with you whenever you want.
Okay.
Okay.
Take
Take
care.
care. Bye.
Bye-bye.